If your child tonight was diagnosed with an emotional problem, what would be the first thing you would recommend someone to do? Who would you seek help from?
Well, I'd go to someone I trust, like my pediatrician, and ask them for a reference to, get referred to a psychotherapist to evaluate my child.
You say psychotherapist, you're talking a psychologist or a psychiatrist?
Psychologist. I would tend to start with a psychologist. If the psychologist does the evaluation and they feel the child really perhaps even might need medication or there's some question of diagnosis, then the psychologist will often write a report and refer them to a psychiatrist who will be evaluated that way as well.
Most psychiatrists, when that's saying all, have a tendency to give medicine and not give a lot of time. Is that correct?
Well, that's very much correct. When I started training in the 70s, psychiatrists were just still doing psychotherapy themselves. They were training programs for them to do psychotherapy. That has changed dramatically in the last 20 or 30 years. Psychiatrists, I would believe less than 1% do any kind of counseling or psychotherapy. It's all medication.
And if you had a choice between a psychiatrist and a pediatric neurologist, say, for ADD medicine, probably better off with maybe a pediatric neurologist over a psychiatrist?
Yes, if it was a what we call simple ADHD situation where there didn't seem to be any kind of intense mood disorder or severe other types of problems, I would most likely start with a neurologist, yes.